The only predictable thing about childbirth is that it's unpredictable. But when you prepare yourself ahead of time, the cards are stacked in your favor for an unmedicated birth. In this video, I'll be sharing what you really need to have for an unmedicated birth. I'm Annabelle Carney, and on this channel, I talk about all things pregnancy, birth, and postpartum, and share my family with you guys. So don't forget to hit the subscribe button and ding the little bell down below so you don't miss a video. Birth at its core is designed to be this incredibly joyful experience. There will never be more of that love bonding hormone, oxytocin, in a woman's body than during a positive birth experience. But unfortunately, feelings of fear and doubt can cancel all of this out. So listen to me when I say this. You can eat all the dates, do all the hip opener exercises, research all the tips, and even hire a doula, but none of that is going to matter if you don't work on this first. Your mindset. Because the act of giving birth naturally requires deep trust, focus, strength, and stamina beyond the body's physical limitations. This is why birth is more mental than it is physical. So if you're going to labor feeling fearful and anxious, you're likely not going to have that positive and euphoric experience you're hoping for because birth begins in the mind. So what do I mean by this? You need to have a firm belief in yourself and your body's ability to birth. Because when those sensations of labor become really intense, you have to find a way to shut out all the noise and keep going through another contraction and another one. And contractions only intensify as you get closer to meeting your baby, which isn't a bad thing. But our mind has this fight or flight response designed to protect us. And in those moments of peak intensity, self-doubt can start to creep in, and you may begin to question your strength and ability to continue. Your brain will register this as an unsafe situation and will want you to fight or flight for safety, which in this case would just cause labor to stall. A study of a little over 2,000 women who wished to give birth vaginally were enrolled in a fear childbirth assessment. And the results determined that labor averaged 47 minutes longer in women who were more fearful and scored higher on the assessment. So that being said, if you don't address your mindset and the way that you think about birth, it will show up in birth. Your body will manifest every internal tension and anxiety that you're carrying, resulting in tension in the body, perceived pain, and thus slow dilation. Pain is a normal part of this process, but it can vary in intensity and sensation from person to person. When a person experiences pain, their natural response might be to tense up their muscles, and tension can manifest as clenched fists, tight shoulders, or a stiff posture. And the body's natural instinct is to protect itself from pain, which can inadvertently increase the discomfort felt during those contractions. Then, as pain intensifies, fear can start to set in. This fear triggers the release of stress hormones, such as adrenaline, which interfere with the body's natural hormone dance. This combination of tension and fear leads to an escalation of pain because now, instead of beta endorphins floating through your body, there's more adrenaline. Then you have tightened muscles, which restrict blood flow and oxygen supply to the uterus and surrounding tissues, which can also amplify the intensity of contractions. So this increased pain further reinforces fear and tension, perpetuating the cycle. So breaking the pain, tension, pain cycle and instead allowing a cycle of trust, relax, surrender is crucial to managing pain during childbirth. Sure, you can quiet those negative voices in your mind with birth affirmations, but you have to trust your body. Tapping into our primal brain that is needed for an unmedicated birth takes a lot of work and requires us to surrender to the sensations that we're feeling, and it all begins in the mind. So how do you get your mind in the right place for an unmedicated birth? Here are 5 things to do to work on your mindset. First, you have to know your why. Understanding your reasons for desiring an unmedicated birth can serve as a strong motivator during challenging moments. Whether it's a desire for a more active role in the birthing process, or the wish to minimize potential side effects for you and your baby, or just a personal belief that birth is a natural process, identify your why, because this can anchor your mindset. Number 2, as early as possible, do some inner work on yourself. So acknowledge how you respond to certain situations that you can't control. Mindfulness in labor is so important, so you need to start practicing early. Squeeze in mindful meditation throughout the day. Notice how you're feeling in this moment. Is there any tension in your body? Can you relax your jaw and your shoulders? Is your breathing shallow? If so, try to take a couple of belly breaths. Or if you've had a past traumatic birth, recognize what happened, heal, and move forward. Acknowledge that it happened, uncover how it made you feel, and share it with someone. And learn about the events that happened in your situation so you can advocate for yourself so it doesn't happen again. Number 3, take the time to understand how birth works. In this medicalized maternity world, birth is often managed. We go to the hospital once our contractions feel strong enough and let the medical professionals take over from there. But when we manage birth, we silence mama's instincts and teach her that she can't trust herself. There is so much more going on when you go into labor than experiencing contractions and dilating to 10 centimeters. But how can you trust your body and surrender to the sensations if you don't know how the process of birth works? So by understanding the basic anatomy and physiology of birth, you'll be able to go into labor without feeling fearful of the sensations or of what's coming next, and your body will be able to progress faster in labor. Number 4, surround yourself with positive birth stories. I cannot stress this one enough. Throughout your entire pregnancy, this is so important to do. So you can do this by reading books, watching positive birth vlogs, or listening to podcasts. The body achieves what the mind believes. And the more that you condition your brain to see that birth is not scary and is a natural process, the more relaxed and confident you'll be. And lastly, number 5, acknowledge and address whatever fears you have for birth through educating yourself. Some fear or worry is totally common during pregnancy, especially for first-time moms. But don't let that fear prevent you from having a positive birth experience. So here's something that you can do to work on that. So using a sheet of paper, write out your fears. Then use a separate sheet of paper for each fear and write down what you think you know or what you were told about that fear. Then do some research on this topic and write 2 to 3 actual facts that you discover. Then I want you to think about how this new information changes how you're feeling. And at the bottom of the paper, you'll write out a balanced statement that validates the fear or concern and replaces that fear-based thought with reassurance and knowledge. So for example, if your fear is a fear of not being able to handle the pain, after doing some research, a balanced statement would sound like this: although contractions may be painful, I will be able to handle it because my body releases hormones to help ease the pain naturally. Debunking our fears allows us to reprogram our unconscious thoughts, but takes a lot of practice and repetition. So with my first pregnancy, I already believed in my body's ability to birth my baby, but I still had a fear of my own. And I did this exact exercise to help clear my fear, and it helped me so much. My mind was so much calmer. So I highly encourage you to take the time to do this before you give birth. All that to say, if you're hoping to achieve an unmedicated birth, you don't have to have a high pain tolerance or be a master at meditation, but you do have to put in the work to get your mind where it needs to be. And this is possible for every woman and within reach. So don't disqualify yourself. Thank you so much for watching, and I'll see you in the next video.